My name is Tony Nardi. I am an emergency physician, primarily at Woodwinds, and I'm also the Physician Services Medical Director for the acute care hospitals. So I participate in medical direction and kind of oversight of the 3 hospitalist services and the 3 emergency departments in Health East. One site at Woodwinds, it's a very suburban hospital with a very suburban sort of population, and your bread and butter sort of emergency medicine that's a bit lower on the acuity scale, but still good bread and butter emergency medicine. St. John's Hospital is again a suburban hospital, but it's bigger, it's been around a longer time, and that's like any other typical emergency department in the country where you're going to see everything that you see in any other ED anywhere. And then St. Joe's is a little different. St. Joe's is a very high acuity emergency department where there's a lot of sick people. It's an older population. There is an inner city population there. You still get a mix of suburban medicine because of where it's situated. So it's different at all 3 sites, and you really get that spectrum. It seemed like a good place to practice emergency medicine that would give me a mix of kind of everything that I thought I valued in practice. And so for me, that was a number of different care sites, a number of different patient populations, the ability to care for patient populations across the spectrum of what we see. I had been in Baltimore, where it's very inner city. I'd been in North Dakota, where it's very rural, suburban, and Fargo and some of those places, and I felt like Health East gave me the opportunity to do all those things across the spectrum. So that was number 1. I think number 2, as I spoke with the physicians that I met, it felt like it was a supportive environment to practice in, where you would be an employed physician and kind of get all the benefits of being an employed physician, but also being in an environment where you could participate and practice as more of a group. So really, in my mind, those 2 main things, which was practice style and the patients you care for, I felt like would give me the exposure across the spectrum of both those 2 factors. The majority of our physicians and the majority of physicians that I come in contact at Health East have a lot of pride in how we do things here and how we deliver care and where their place at the table is and how we value them. And I think that breeds I like to think that breeds happy physicians who enjoy caring for patients, and that's what I try to convey. I think you get that sense from being around here, but that's what I try to convey to them and tell them that you're going to be in a place where you're able to care for patients in an environment that's conducive to caring for patients. I think that's important.